The broadcast is now starting. All attendees are in listen-only mode.
Hi, good afternoon, everyone. Thank you for bearing with us as we we're giving some people some time to log in. I know the webinar software sometimes comes with some technical difficulties. I'd just like to say good afternoon to everyone and thank you for participating in this webinar today. As some of you may know, this webinar is part of our ongoing series to explain how the Affordable Care Act benefits members of the Asian American, Native Hawaiian, and Pacific Islander community. And so far we've done several in various HHS regions, and we are very excited to be here in Region 9 where the Health Forum is headquartered. I want to keep my comments short because we have a lot of really great speakers today, but I wanted to make sure that I tell you a little more about the Asian Pacific Islander American Health Forum. We were founded in 1986, and our mission is to influence policy, mobilize communities, and strengthen programs and organizations to improve the health of Asian Americans, Native Hawaiians, and Pacific Islanders. And so I'm Paulo Pontmeyer. I serve as an advisor for government relations for this organization, and I'd like to quickly introduce our speakers today. We are very fortunate to have Mr. Schultz, who is the director of Region 9 for HHS, being part of this call. We are very grateful to his office because, as many of you in the phone who have called into some of our past webinars, he's never turned down an invitation from us to be part of these ways to really inform our communities about the great things that HHS is doing and what the ACA means for a lot of us. And we really appreciate him as a true partner to help us advance the health of our communities. Following him will be Dr. Nguyen, who serves as a commissioner with the White House Initiative on Asian American and Pacific Islanders. Dr. Nguyen will be providing some background on the initiative's great work because they really are the place that brings our voices to the highest levels of President Obama and his administration. And following him, we'll be hearing some viewpoints from some of our local partners who do lots of great work in Region 9. The first speaker will be Dorina Wong, who's the project director of the Asian Pacific American Legal Center in Los Angeles. And she has been a very great close collaborator with us here at the Health Forum. And we'll be hearing about some of the community initiatives and outreach work that they do. Finally, our last speaker will be Jonathan Tran, who manages the California office for the Southeast Asia Resource Action Center. And just like Dorina, he'll also be talking about the great work that their organization does, and particularly for some of the most vulnerable populations under the AANHPI umbrella. So with all these great speakers, and I know we have a lot on our plate, I'd like to now yield it to Mr. Schultz at HHS to begin.
Thank you very much, and I want to say thank you to Dr. Nguyen and his leadership on the White House initiative, to our always significant partner in the Asian Pacific Islander American Health Forum, and thank our partners from there, and especially a nod to Kathy Coe, the National Executive Director. This is Herb Schultz, Regional Director for HHS Region 9. And just as a reminder, as I think all of you know, Region 9 encompasses not only the states of California, Nevada, Hawaii, and Arizona, but the territories of American Samoa, Guam, and the Commonwealth of the Northern Mariana Islands, as well as the Federated States of Micronesia and the republics of Palau and the Marshall Islands. And I have, I think, a difficult job today, and that is one to impart some wisdom about the Affordable Care Act in about 20 minutes. What I want to make sure is that you know that all of the slides that we go through today will not be the entire slide deck that you have access to. And let me start and just say thank you to my colleague Steve Weiner, who is with me on the phone as well. So the name of this webinar is How Does the ACA Help Asian Americans, Native Hawaiians, and Pacific Islanders? And if we go to the first slide that says Office of Regional Director, I just want to remind everybody that we are a 24/7 resource, and we're working very actively with our states, with our territories, with the freely associated states, not just at the governmental level, but also at the level of community-based organizations, faith-based, physicians, doctors, health professionals. In other words, please use us as a resource and we work in coordination with the White House Initiative and the Asian Pacific Islander American Health Forum. So what we're going to talk about for the next 20 minutes, if you go to the next, is just the fact that for the last 2.5 years, there has been the historic implementation of the Affordable Care Act, or what we call our federal health care law. And I want to stop for 1 second and just say thank you to all of you for your advocacy and your activism. No matter where you sit, this administration recognizes that we have historic health care reform, and we are working together to improve the lives and health of Asian Americans, Native Hawaiians, and Pacific Islanders because of the advocacies of the communities that were most affected and needed, desperately needed, health care reform. And health care reform is here, and now we are past the Supreme Court, and we are continuing to work together with you to implement this very important law. I want to turn you to the framework of health reform and just say that while this is a federal law, so much of this is about the importance of states, local governments, territories, freely associated states, all partners, governmental and non-governmental, community-based organizations working together to control our own destiny. So if we go to the slide that says Framework of Health Reform, I'm going to briefly in the next 15 minutes walk you through some very specific slides about what the overall framework of our federal health care law is. In other words, what are the 3 legs of the stool in order to underscore this discussion. By the end of it, you'll have my email, our cell phone, and a continued way to keep in touch with us 24/7. So let's just think about the Affordable Care Act and its impact on Asian Americans, Native Hawaiians, and Pacific Islanders with the 3-legged stool. It provides expanded access to health insurance coverage and coverage. It provides consumer protections for those who are already insured, and we'll talk about those who are going to be insured, if not already, will by January 1, 2014. And then it will improve quality and lower costs, but we can do both together, improve the lives of our various communities. At the same time, we make it affordable and comprehensive for our Asian American, Native Hawaiian, and Pacific Islander communities. So what this law means to you, the next slide, better access to care, consumer protections that are enforced today. It makes health care more affordable and a stronger Medicare program that is extraordinarily important for our seniors and for people with disabilities on Medicare. So as we get into the first bucket, in our next few minutes, the individual requirement that everybody has health insurance. It's important to note 2 things. The requirement that most U.S. citizens and documented individuals get coverage begins on January 1, 2014. There are some exemptions to that, and they are listed. But on the flip side, the thing that we want all our communities to recognize is that you will never be turned down for insurance because you have or have had a pre-existing condition like asthma, like diabetes, obesity, heart disease. And we know that through health disparities that we all want to eliminate, and that this law does a lot to reduce and eliminate racial and ethnic and geographic health disparities. That individual mandate is January 1, 2014. It's also important for those of us in all of the communities that we're talking with today, and we have, and in the future, is that most of the small businesses in this country writ large is under 50 employees, and they are not subject to the penalties. We know that everybody wants to try and provide insurance, but for those businesses that are not able, under 50, which are 96% of all small employers, do not have to pay penalties, but will have access to other ways to get credits or help with paying monthly premiums, monthly out-of-pocket costs for those who are moderate and lower income. It's important to mention there's small business tax credits and small business credits that are already in effect. And as we sort of go towards the consumer protection side, let me just make this comment. There's a lot of conversation that's going on about the so-called new marketplaces. What do I mean by that? I mean for individuals and for small businesses under 50. We know that in the system that we're moving away from, and we know from talking with many of the Asian American, Pacific Islander, Native Hawaiian communities, many people have been denied health insurance because of these chronic pre-existing conditions. I'm a person living with HIV. I have for 21 years, and I understand the issues that many people face. Well, in moving away from that, there is going to be a new marketplace. If you do comparison shopping, if you are familiar with Travelocity.com or TakeYourFavoriteStore.com, and you look at, there will be a place where individuals, where small businesses under 50 who do not qualify for Medicaid or Medi-Cal can go and get significant help with their premiums and with their out-of-pocket costs, if you will, and we can go through who are eligible for that. The other thing that's important, and we'll go up to the slide, that talks about expands access through public programs. Why on, if you will, the private side, we help individuals, we help small businesses in our communities better afford and better be able to offer health coverage. We are expanding our public programs, and the states and the territories have an option to expand their Medicaid programs to largely childless adults in our communities that have not, under the system that we had before, eligible to receive Medicaid. And so that is individuals under $15,000 a year will be able to, depending on the state and the territory and whether they expand the Medicaid population, it's voluntary, will be able to choose a Medicaid plan that works for lower income individuals. And we can get into the health disparities issue in a minute. And we will be paying our Medicaid doctors significantly greater dollars over the next 2 years to ensure that the Asian American, Pacific Islander, Native Hawaiian communities and others have access to the physicians and the nurses and other professionals needed to serve such a critical population. So on the public side, on our private side, there is the ability to get health insurance, to be able to afford it through helping with out-of-pocket costs, with lower premiums, and the expansion of our Medicaid program. If we go over to the slide that says the law stops insurance companies from taking advantage of you, critically important in my last 6 minutes to let you know that health insurance companies now must be spending 80 cents or 85 cents on every dollar, 80 or 85 cents on every dollar towards health care and the benefit side, and only 15 to 20 cents on profit. Why is that important? Because that means that the consumer will be able to ensure that they're getting the value and they're getting their bang for the buck. And if these insurance companies do not make that 80 or 85 cents, all of our communities, all of our individuals and families, every August 1 will receive rebates. And those rebates this first year totaled $1.1 billion back to our communities. So I want to go over to the slide that talks about the young adults 18 to 26, and then I'm going to get into prevention, health disparities, and close it with some very specific issues that we together are working on to address health disparities in our Asian American, Native Hawaiian, and Pacific Islanders communities. For those that do have access to insurance today, children between 19 and 25, young adults, can stay on their parents' policy. And as you'll see from some of the slides, thousands of the communities that you represent that we're talking with have already taken advantage of that. There are significant dollars if you look at promoting prevention and improving public health. There are significant resources that are being provided in our Asian Pacific Islander, Asian American, Native Hawaiian populations to ensure that people focus on individual health. There are free preventive services. It is not legal in this country anymore for children to be denied health insurance because of a pre-existing condition. Childhood immunizations, well-woman visits, cancer screenings like mammography and colorectal screenings for Medicare beneficiaries, for those that have insurance on the private side. People can no longer be charged any out-of-pocket costs for those. And so whether you're talking about where you work, where you live in your community, or as individuals and as small businesses, there is help to ensure that we are focusing on prevention and chronic disease wellness on an upfront basis. That not only saves dollars, it improves the lives of our communities, and that's what's most important. If you go to the slide that says the law strengthens Medicare, many of the people that I've spoken with, many community members in our Asian American and Pacific Islander and Native Hawaiian populations, very high prescription drug costs for those with chronic health care conditions. No more, because we have 50% discounts on prescription drugs today, and we will have zero, if you will, no senior, no person with a disability should ever have to choose between food and medicine because they are being taken advantage of by having to pay too much for their prescription drugs. So as I go to my last couple of minutes here, I want to turn to the slides that say ACA and health disparities, improving health equity, and very specifically talk to the issues that all of you on the phone have worked so hard and are continuing to partner with us, like the Whole Health Forum, like the White House, like our partners here from our other organizations, to improve health equity, diversity and cultural competency, and incentives and initiatives to increase diversity in things like our healthcare workforce, making sure that they are doctors and physicians and professionals that represent the communities that are most impacted by these. If we go to the next slide, what I want to share with you is that there's an HHS action plan to reduce racial and ethnic health disparities and increased funding for community health centers so that we can ensure the expansion of places where our communities can get good quality preventive health care. And so if we go to the slide that says ASPE Research Brief, the important thing that I want to share with you is 97,000 young adults in our Asian American and Pacific Islander and Native Hawaiian populations that would have been uninsured now have coverage. 2.7 million already with private insurance now don't have those out-of-pocket costs. 867,000 Medicare beneficiaries have access to a stronger program that includes significant discounts on prescription drugs for those that are chronically ill. And important that by 2016, up to 2 million more Asian American, Native Hawaiians, and Asian Pacific Islanders will have quality health insurance at an affordable rate. I also want to say one thing about making people count new data standards. Because of your work, no longer will we have a system or a federal government that doesn't collect information or data that reflects the community, that reflects the people in the communities that we're talking about, your and our communities that had to check an other box. And so there are now 9 additional data collection categories so that we can ensure that not everybody is put into 2 or 3 buckets that don't reflect the diversity and the trueness of our Asian American, Asian Pacific Islander, and Native Hawaiian populations. And that is with your strong work that's there. If you turn to additional specific provisions, there are very, very specific provisions on oral health care, on reauthorization of Native Hawaiian health programs, and on minority health that directly impact, as these other provisions do, to reduce and eliminate racial and ethnic health disparities in the populations and in the country as a whole. As I end, I want to let you know that there are a lot more things that we could talk about. If you go to Without the Affordable Health Care Act, you can see the statistics that are written down here. But this historic law, our federal health care law that is in place now, we will not continue to be successful if we are not working with our key, not only governmental partners, but our key partners like all of you on the phone, and very specifically ensure that all of the provisions, and especially those specific provisions that you have advocated so successfully for, that are very directly to ensure that there is good, not only access, but coverage for millions of Asian Americans, Asian Pacific Islanders, and Native Hawaiians that have not had access to insurance coverage, that have not had access to affordable insurance coverage. And so to learn more, there are a number of websites. Not everybody has, the web. And so if you turn to the contact information, you will notice on the last slide that I have both my cell phone and my email. We have Stephen Weiner's information as well. We want to be able to continue to partner with you, with the White House, with the Asian Pacific Islander American Health Forum, with our partners that are on the phone today, from the Asian Pacific American Legal Center, from the Southeast Asian Resource Action Center, and Dr. Wynn and his leadership on the White House initiative. But it takes all of us, and you have my commitment as the regional director in Region 9, that we look forward to continuing to work with you. No question is too small. We are working together, and we will not rest until we're ensured that we're doing everything we can to ensure that our Asian American, Asian Pacific Islander, Native Hawaiian populations not only have access to, but have the coverage, the affordable health care coverage that this historic law provides. Thank you very much.
Thank you, Mr. Schultz. We always learn something new whenever we have you on our presentations, and so we really appreciate the fact that you will be very available to many of us in this call. And the slides will be available later, so please don't worry if you weren't able to write that information down. And now I'd like to pass it on to Dr. Wynn, who will be talking about the work that the White House Initiative on Asian Americans and Pacific Islanders do for all of us.
Thank you, Paulo. On behalf of the initiative, I want to thank the Asian Pacific Islander American Health Forum for sponsoring this call, and really for all the great work that the forum has done for the health of AAPI communities all these years. And I definitely want to thank Mr. Schultz for his work in Region 9, for the particularly useful information that you just given and your commitment to listening to the communities. And also I want to thank my co-presenter, Dorina Wong and Jonathan Tran, for their perspectives, which is about to come. I want to take this opportunity to tell you about the initiative, which was established by President Clinton and reestablished by President Obama. I don't have slides, but I'm just going to speak for about 4 minutes. Reflecting the priority of APIs in President Obama's administration, 2 cabinet-level leaders are actually co-chair of the initiative, Cabinet Secretary Chris Liu, and Secretary of Education Arnie Duncan. Kieran Ahuja is our Executive Director, and before coming to this position, she spent 20 years working for our communities and was the founder of the National Asian Pacific American Women's Forum. This is really to reflect the importance of the community in our initiative. The leaders and the staff of the initiative are assisted by the Advisory Commission, which consists of 20 API leaders from across the country with expertise in a variety of fields. And we currently focus on 4 major areas of concern to APIs: economic and sustainable development, civil and immigrant rights, education, and healthy communities. The initiative's main goal is to ensure that the government work better for APIs by serving as a liaison between the communities and the federal agencies. Since President Obama reestablished the initiative in 2009, we have met with more than 25,000 community members in 26 states through a variety of summits, roundtables, and town halls. And we have conducted numerous teleconferences and webinars to increase knowledge of federal efforts that affect APIs. We have also actively channeled concerns about these policies that impact our communities to federal agencies. We actually work with and monitor the plans for API of 23 federal agencies, just so you know the scope of our work. Through our engagement and the leadership of President Obama, the administration has implemented many policies that have and will benefit APIs. I think you heard a little bit about that in Mr. Schultz's presentation. In particular, in health, President Obama and Health and Human Services Department have created a plan for API health disparities that address crucial issues such as hepatitis B, diabetes, cancer, cardiovascular disease, and hypertension. The administration has also begun to address a major goal, which is to increase appropriate data collection among APIs. The data standard policy at HHS now is to collect disaggregated race and ethnicity data so that we'll be able to obtain data not just on Asian Americans or Native Hawaiians or Pacific Islanders, but also for groups such as Chinese or Koreans, Vietnamese, and so on. You've just heard about the Affordable Care Act, which in our view is the most significant game changer for the health of APIs in the last 40 years. As a health researcher, I can tell you that in studies of health and health behaviors among APIs, having health insurance is the single most important factor that applies across all segments of the API community. And as you've heard, about up to 2 million APIs who currently do not have health insurance will benefit by getting affordable health insurance. A couple of last words about what we've been doing. The initiative has been conducting outreach to increase knowledge about the Affordable Care Act through various activities such as this one. We conducted regional summits, including this year a Southeast Regional Summit in Atlanta with over 500 community members and leaders, a Midwest Regional Summit in Ohio with over 300 community members and leaders, and a recent Emerging Community Forum in Oakland, California with newly arrived populations such as Mongolians, Burmese, and Bhutanese. And we've been working with HHS to ensure that API priorities are heard during the planning and implementation of various components of ACA. However, I do want to emphasize that everyone in the API communities should feel empowered to communicate their concerns and suggestions to federal and state agencies about the ACA. One particular action item that I think people should look into at the state level is to increase API presence in the state insurance exchanges by communicating your concerns directly with your government leaders or participate in advisory panels. Thank you all for attending this webinar. The initiative and the commissioners really serve as a channel for the community's concerns and suggestions to the President, and we are here to help, so please let us know how we can do that. I will turn this back to Paolo. Thank you.
Great, thank you, Dr. Nguyen. And so now, without further ado, I'd like to talk to or have some of our community leaders talk about some of the great work they're doing. And so I'll start off with Ms. Long over at APALC.
Oh, thank you, Paulo. And I want to thank the Health Forum as well for inviting me to present on this webinar, because I think it really is critical that we make sure our community knows about the ACA. There's so many benefits, and it is such a great remarkable historic effort to increase access for our community. I also want to thank my co-presenters, Herb Schultz and Dr. Nguyen and Jonathan, because I think as a team we all have the same goals in educating our community. So what I wanted to do is just quickly let you know who, for those of you who don't know, who the Asian Pacific American Legal Center is, and of course you already know why we should care about healthcare reform, but also just to give you a little information about the recent Supreme Court decision. You can go to the next slide, yes, where, just to see how that has impacted our community. We're all very relieved that the ACA has been upheld, but, there are some implications from that decision. Also, what does healthcare reform look like in our region, especially in California, and then just end up with some resources and what you can do to help. The next slide. So who is the Asian Pacific American Legal Center? And we're a member of the Asian American Center for Advancing Justice, and we, which is an alliance of 4 organizations, as you can see on the slide. But we're the Asian Pacific American Legal Center is the largest legal and civil rights organization for the Asian American, Native Hawaiian, Pacific Islander community, and we generally advocate for our civil rights. And we provide legal services, direct services, as well as impact litigation, and education and technical assistance and policy advocacy. We also try to provide some capacity building and to strengthen coalitions to empower our Asian American, Native Hawaiian, Pacific Islander communities. We're located in Los Angeles, and we've been around for close to 30 years. Next slide. And so we realized with the passage of the ACA that there was an extraordinary opportunity to do some outreach, education, and advocacy, because it really is important for our community to know about what the ACA is and how it benefits us all. I think there's a lot of confusion out there about all the benefits and why we should support the ACA. So we created the Health Access Project to address the healthcare needs of our community, and as I say, do some outreach, education, and advocacy. Make sure that our diverse community understands what healthcare reform looks like, especially in California, and to develop strong collaborations with other Asian American, Native Hawaiian, Pacific Islander organizations throughout the state. Next slide. And so some of our, next slide, please. And some of our activities, back one, include looking at creating the statewide network. And so we have 8 regional partners and at least 20 local partners within LA. And we've created a health justice network to try to coordinate our efforts throughout the state. And then we're trying to also collect and translate materials, culturally and linguistically appropriate materials. So be a clearinghouse of those materials, because we know that there is a lot of materials out there, but not necessarily addressing the needs of our community in the right languages for our community. So we hope to at least translate some of the materials into at least the 8 relevant languages, depending on the issue and depending on the region. And so we will have on our website a resource center where people can go and click and get materials, and developing our own materials when we identify where the gaps are. So for instance, we've developed a 1-page kind of an infographic about the current benefits under the ACA. We also want to do, as I said, some outreach and education to our community to make sure people understand what it is in the ACA and how to access, existing benefits now and what's all the changes that will happen in 2014. So we've been conducting trainings. We're going to be developing a curriculum to train trainers, to train our community partners so they can go out and do trainings for their constituents. So we also are reaching out to small businesses, because as Herb described, there are a lot of benefits for small businesses, and a lot of our community are small business owners and workers. And so we've been having a number of trainings and also webinars like this, and we will be continuing to do that. And then finally, we want to do policy and advocacy, because we need our voices heard, and we need to be at the table when critical decisions are being made. So for instance, in California, when there's the exchange meetings that I will go into a little more in a moment, we want to provide public testimony, provide written comments when there's requests for that, but not only before the exchange, but also before federal regulators who are making proposals and issuing guidances to provide information to other states on implementation issues. and you can go on to the next slide. So when we talk about why we should care, I just wanted to quickly point out that even though there's an average uninsurance rate of 14% for the Asian American, Native Hawaiian, Pacific Islander community, our community is so diverse that it ranges from about 8% for the Japanese community all the way to 23% for the Bangladeshi and Pakistani community, or 21% for the Cambodian community. So that's why it's so important for all of the needs in our community, for the Asian subpopulations to be represented. Next slide. And so bottom line, we need to actually support the ACA and get the word out, because a lot of the benefits, as has been pointed out, already exist now. People, if they understood that there are all these things that they could, services that they can access, they would be much more supportive of the ACA. Also in 2014, there's going to be a whole new healthcare system, and we need to make sure our community understands that. So implementation is happening now, and every state there is something happening around healthcare reform. And we need everyone's input and support, including those in the Asian American, Native Hawaiian, Pacific Islander community. And there are still threats to healthcare reform. We've kind of overcome one of the threats by getting past the U.S. Supreme Court, which I'll mention in a moment. But actually, there are members of Congress who want to repeal the ACA, and so we have to make sure that that doesn't get, that doesn't happen. And we also want to establish health care as a fundamental right, so everyone has access to health care. So it has to be part of a larger progressive agenda. And we need the government to be involved. This isn't something that the private sector can do. Next slide. And next slide. And so when we're talking, next slide, please. I wanted to just share quickly about what the Supreme, go back to the Supreme Court. Yes, what the Supreme Court ruling meant to our community and actually to all of us. Now, there are 4 issues. And just let me say this, that the decision was over 260 pages, so I cannot go into all the details, and I'd be happy to go into it and, go talk about this in more detail, but I just want to quickly go over what the holdings were and how it affects our community. So there were 4 issues. The first issue was trying to decide whether that minimum coverage, which is also known as the individual mandate, was a tax or a penalty in order for the whole lawsuit to go forward. And then the Supreme Court in Justice Roberts' decision said that yes, it is. It was only a penalty and not a tax for statutory purposes, so that the case could go forward. Now, the second really big issue has to do with, again, that minimum coverage or individual mandate, and that is whether or not that was a valid authority under Congress's power. And although they did not find it part of what we would call the Commerce Clause, they did find through Congress's taxing power that it was a valid exercise of Congress. And so fortunately, because this is the provision, the individual mandate that many of us thought was the most vulnerable, and fortunately it was upheld. So we're very happy about that. But the other surprise in the decision was the third issue about whether the government could expand the Medicaid program, because almost half of the people that will be covered under the ACA will be covered under the Medicaid expansion, and that will cover people with incomes up to 138% of the federal poverty level. But so the good news is that the Medicaid expansion was upheld under Congress's spending power, but the remedy for a state that did not agree to expand their Medicaid program was struck down. So they said it was coercive, which is actually, the first time that that the U.S. Supreme Court has found that one of the public, expanding public benefits program like Medicaid was too coercive, because they were afraid that a lot of state budgets are very dependent on the Medicaid program. If there was a threat that they could lose all of their Medicaid program, that was too coercive for the states. So basically it is voluntary on the part of the states, and I'll just mention why that's important in a moment. And then finally, whether the fourth issue was whether the provisions of the Affordable Care Act were severable, and they did find that they were, because if they weren't, if they found that the remedy provision of the Medicaid expansion was not severable, they might have actually struck down the whole law, and we wouldn't have any kind of health care reform at all. So we are happy that they found, they upheld the ACA basically. Next slide. So what does it mean? What it means is that some states will take up the Medicaid expansion. We're hoping that all the states will, because actually the federal government is actually paying for 100% of this new expanded category that will cover millions of people. And although some states like Texas and Florida, Mississippi, South Carolina have said no, they're not going to do it, we think that in the end, most states, if not all, will do it, just like all states have the Medicaid program, because they will see that the funding is so crucial to their budgets that it's in their best interest. But so it's going to affect at least 1 out of 10 Asian Americans and 1 out of 8 Native Hawaiian and Pacific Islanders. So the exchange planning in the different states will move ahead, but there is still work to do, because there's two categories of individuals in our community that we should be concerned about. There is still a 5-year bar for those in the Medicaid program, that if they came, even if they're legal, even if they're a legal permanent resident, they have to wait 5 years before they are eligible for the Medicaid program if they came after April 22nd, 1996. The other category of immigrants that are not covered under the ACA are undocumented immigrants. They can't even, not only they don't qualify for Medicaid unless it's an emergency service, but they cannot even buy into the exchange. Next slide. Okay, so what does health reform look like in Region 9? And that would be Arizona, Hawaii, Nevada, Guam, American Samoa, and California, and some of the other territories. So the good news is that actually all of the different states are doing something in terms of an exchange. Already Hawaii, Nevada, and California already have exchanges. American Samoa, Guam, and Arizona are planning in the planning stages. All of these jurisdictions have gotten federal funding to do planning for the states, planning for the exchange, and also most of them are also probably going to go forward with the Medicaid expansion. There's a question in Arizona. The governor has not actually committed to it. She's going to decide in January. And Nevada may be leaning a little bit against it, but the other jurisdictions are going forward. Next slide. Next slide, please. Okay, so what does it look like in California? Well, as you know, the California is the most diverse state in the nation. There's 15% of our population in California are Asian American, Native Hawaiian, Pacific Islanders. Next slide. And in terms of the uninsured, it's about 13% on average. Next slide. And what we also know, next slide, please. What we do know is under the Medicaid expansion, the Medi-Cal program, as it's known in California, this means that over 300,000 Asian American, Native Hawaiian, and Pacific Islanders are eligible and can be covered. So it's going to impact a lot of people in our state. And actually, when you look at the limited English-speaking population, which is about 36% of the newly eligibles, and so we have to make sure that there's cultural and linguistic access for that population. Next slide. And in terms of the health exchange, again, there's going to be over 350,000 Asian American, Native Hawaiians that are eligible, and there's even a higher limited English-speaking population. So I just wanted to show these. Next slide. Next slide, please. And so I just wanted to quickly go over, I'm not going to go over all of these areas, but these, so can you go back one slide? Okay, so specifically what it looks like in California, we were the first state to establish our health benefit exchange, back in 2011. We have 5 members and they meet monthly. Most of the meetings are in Sacramento, but due to the good advocacy on our part as well as our partners like CIRAC, we managed to make sure that they do it outside of Sacramento. So they have done it in the Central Valley and the Bay Area, and in November they'll do it in LA, but most of the meetings are in Sacramento. But there are many critical decisions made at each of those meetings, and they're done very quickly. So we're trying to keep our Health Justice Network partners involved, but it has been a challenge. Next slide. So some of the issues that have been covered, this is just a listing. Because California is, I think, ahead of many states, these are the kinds of issues that probably will come up when you're trying to move and work with the exchange in your particular area. There's a whole, it's been contracted out to look at the eligibility, enrollment, and retention system. There's a lot of consumer assistance issues around the marketing and outreach and assisters program. I think Jonathan's going to be able to go into this a little more, as well as the service center options. And at the next the August health exchange meeting, there's going to be decisions made on like the SHOP exchange, which is for small businesses, the qualified health plans, and the service center options. So all of these issues are coming up, and you can go to the next slide. So we just wanted to, I just wanted to highlight it for you so you would know all of the different areas that, when you're thinking about the exchange, what you might encounter. Okay. And this is just, in California, these are just issues that I think are relevant to our community. And in California, I think we're pretty lucky because we have gone even beyond what is required in the federal proposed rules. And so we'll be happy, I'd be happy to talk a little bit about how that happens. And but I don't have time to go through it now. So I just wanted to just, next slide, end with what you can do, and as you know, educate yourself and participate in coalitions, and really provide input and public comments to whatever is happening in terms of housing reform in your particular state, and make sure that data is collected and make sure stories are collected, because it's very important to put a human face on these issues, and then support policies and advocacy to increase healthcare access. And then the next slide will just is some resources that we have, and my last slide is just our contact information for myself and other members in our Health Access Project, and that's it. Thank you very much.
Thank you, Jarina. And so just for our final speaker, I'd like to introduce Jonathan just to talk about his work at CIRAC.
Sounds good. Thanks so much, Paulo. Well, first of all, I want to thank folks for sticking on the call on a Friday afternoon. It's kind of warm all over the West Coast this week, so thanks for sticking with us. And also thank you to the Health Forum for all the work that they do. We definitely take our lead from all the work that Paulo does in D.C. and us folks here in California. So thanks so much. And also to Dorina and Mr. Schultz and Dr. Nguyen for all the work they've done in terms of making sure their communities have access to the services and support that they need. I know I have a very limited amount of time left. I know folks that only signed on to stick around until 2 p.m., so I'm going to try to breeze through my presentation and focus primarily on the efforts of what CIRAC has done in terms of working with other community-based organizations. If you can move to the next slide, just a quick description of what CIRAC is. We're a national organization based in Washington, D.C., but we also have our office here in California, here in Sacramento. But we partner with community-based organizations all across the state, stretching from Long Beach, California, with the Cambodian community throughout the Central Valley, and also here in Sacramento. And we work collectively on issues impacting refugee populations. Moving on to the next slide. Dorina actually brought this chart up earlier. Much of similar information in terms of breaking down the demographics within the Asian American community. I just wanted to take this opportunity to highlight some of the populations that are primarily impacted with underinsurance or lack insurance altogether, and predominantly fall within the Southeast Asian populations, including the highest with the Vietnamese, Laotian, as well as Cambodian Americans. And so for this demographic in particular, the efforts around making sure that community members understand the benefits that they have now with the Affordable Care Act has been a huge focus for our organization. And we can move to the next slide. And a primary reason for this is because there's significant portions of our populations that rely on public insurance as their only form of health coverage. And so if you look at the Hmong community, for example, it's almost divided 50-50 between the number of individuals that have private insurance and public coverage. And so as the Affordable Care Act moves towards implementation in 2014, the impact that the implementation process will have will be significant within the API community, particularly because so many of our community members rely on a type of public service, public health coverage. And in particular here in California, which leads me to the next slide, the bulk of the flow is actually going to come through California's Health Benefit Exchange. So Dorina mentioned most of the details in terms of how the exchange was set up in the first place. There are actually 5 members of the exchange that are carrying out the bulk or making the decisions on the bulk of the elements of implementation here in California. I think the exchange is probably the most significant piece of the implementation process of the Affordable Care Act. And like Dorina mentioned, every meeting they're making decisions on some profound provisions of the Affordable Care Act, and the impact of those decisions are stark, and everything is moving incredibly quickly as we prepare for the 2014 deadline. Let's move on to the next slide so we can dive into a little more detail of some of the elements and key issues that the exchange is dealing with. We're not going to have time to go through all of these elements, but we're going to focus primarily on the marketing and outreach and education plans of the California Exchange and how Asian American communities and community organizations and community members can play a role in each of these action plans that the Exchange is developing. But so far, these are the plans that the Exchange has already drafted up action plans for. So in the area of consumer assistance, they already have action plans that they're working on implementing. Statewide assisters and navigator plans, service center options, and qualified health plans. All of these can actually be found on the Exchange's website. But for community members that are limited English proficient or are not familiar with how public policies are created, this can become a very complicated and cumbersome process. So here at CRAC, what we've done is to try to make this information as digestible to community members as possible, to give them opportunities to provide input. And the biggest area that they've provided input is actually within the area of marketing, outreach, and in the education plan. If we can move to the next slide. I'm going to skip the demographic slide and jump just right into the action plans itself. And so part of the reason why the marketing and outreach and education plans are so important within Asian American populations, one of the examples we like to use at CRAC is what was done in Massachusetts. Actually, what wasn't done in Massachusetts in the first year that they established their exchange. So a correction earlier, Massachusetts is the first place to establish an exchange. They did so several years ago. What happened in the first year of their exchange was that participation in the exchange within minority populations, within Latino, and particularly the large Cambodian community in Massachusetts was very weak. But it wasn't until the second year in which some of the health agencies reached out to some of the community-based organizations to do the marketing and outreach strategies and partnering with those community-based organizations that Massachusetts was able to penetrate some of those harder to reach populations. And so in reflecting on California and other states within Region 9, this is a key priority in terms of looking to implement the Affordable Care Act in those respective states. But here in California, the actions plans were actually subcontracted out to Ogilvy Public Relations, and they developed a comprehensive action plan in order to do the marketing and outreach and education plans. And the exchange's objectives are listed below so per year. And so these are very, very ambitious numbers that the exchange is hoping to hit. We'll go to the next slide. I'm not going to go into detail on all of the, there's about 7 phases that stretches from 2012 to about 2016. I'm not going to have a chance to go into each of those phases, but we're going to focus primarily on phase 1 and phase 2 because those are the most current and most relevant phases of the implementation process. So in phase 1, it's known as what is the building out process. This gives an opportunity for Ogilvy and other folks that are working with the exchange to begin to continue to do the research necessary for branding and creative development of materials. And branding is going to be a huge element within the exchange. If you told my mom to sign up for insurance and threw her in front of a computer and told her to go search for the exchange, she's going to be incredibly confused. And so those elements about helping community members understand what the exchange is in the first place are going to be built into this phase 1 process, and it's going to continue on in the phase 2 process. In addition to the broad overall action plans that the exchange is developing, California has a unique process in which they're targeting specific populations that we'll see in the next slide. And so there's actually a specific Asian American and Pacific Islander outreach and marketing strategy that will be used in both phase 1 and phase 2. I'm going to offer some of the broad strategies that they're hoping to include, but also offer some criticisms of the action plans as it relates to comments that CRAC as well as APALC have submitted to the exchange. The key element within phase 1 is the partnerships with the community-based organizations as a primary element of how they're going to educate community members about the opportunities that the exchange presents. And this includes partnerships with community-based organizations across the board, statewide, pan-API organizations, and also API community-based organizations that do direct services in local communities that are ethnic-specific that serve unique populations. And so there's additional funds that are going to be allocated from the exchange to set up these formal partnerships with community-based organizations. Additionally, the action plans call for partnerships with faith-based leadership, community leaders, medical centers, small businesses, and also emphasis on marketing strategies and flyering at community-based events. But here's where the action plan kind of goes awry, which is the next page. If you look at the details of the action plans and the draft action plans that were originally drafted by the exchange, they included outreach strategies that primarily targeted a young, relatively educated, relatively privileged East Asian population. And so they included things like an Asian import car club scene, the nightlife club scene, casino and card clubs, Asian American college fraternities, factory outlets, and karaoke bars. These were ideas that were originally drafted and included in the action plans that were submitted to the exchange. For obvious reasons, these become very problematic in terms of, are these the most effective ways of reaching into the hard-to-reach populations, and does it actually isolate some populations versus the others? So after commenting from community-based organizations and the efforts of APALC and other organizations along with CRAC, we were able to include additional plans into the final outreach and marketing strategies included in phase 1, and in particular emphasis that was placed on harder-to-reach areas like rural populations in Central California. So the reality is that this input by community members actually made a difference in terms of the need to partner with community-based organizations. In phase 2, we'll just jump to that slide really quickly. The key element I want to point out here is the emphasis on ethnic media outreach. That's going to be huge in 2013 in getting folks ready. So I think in terms of leading to the last slide, I'm just trying to wrap up in my 10-minute time frame. Leading to the last piece, which is it's incredibly important for all of us to continue to stay engaged in that process of implementing the Affordable Care Act, and in particular making sure that the exchange is accessible as possible. And so first is to continue to provide oversight. If our organizations weren't at the table at the time of these action plans being developed, all we would have is outreach into exotic club cars or exotic car shows and casinos. The reality is that our community-based organizations need to be a part of that process. And that comes in particular with setting up formal relationships with the entities that are making these types of decisions and formal partnerships on a local level with counties and local Department of Health. And the other element is primarily to continue to tell our story. I think predominantly it penetrates every area of public policy. The model minority definitely persists, and in particular in the area of health. Everyone just assumed Asian Americans are doing well, but we need to continue to educate policymakers. We need to educate other advocates and continue to be on top of these decisions that are taking place. And the last piece is just to stay in contact, which leads me to the last slide, which is CRAC's contact information. If you go to CRAC's website, we have a health policy information hub that provides fact sheets that we produce that are translated into some of the Southeast Asian languages, including Hmong, Lao, and Cambodian. And you can also follow us on Twitter. And with that, I think we can open up for, I'll throw it back to Paulo and begin the Q&A.
Yeah, thanks, Jonathan, for doing that. And I just wanted to thank, again, all our speakers, Mr. Schultz, Dr. Nguyen, Ms. Wong, and Mr. Chan for joining us on a Friday, I know, in August, where many of us would like to be on vacation. I just want to be mindful of everyone's time, and I know that we had initially planned for doing some question and answer for this webinar, but in the interest of being respectful of everyone, I just wanted to have my email address out there for anyone who thinks of any questions that they would like just to email me, and we'll do our best to direct it to any of the speakers here. But before we adjourn, I'd like to just thank my colleague, Franco Chamakili, who helped put together this webinar and set it up and did a lot of the logistical work. I think this is one of our webinars where we didn't have a lot of technical difficulties. We've already gone around the country with this, and I think we seem to improve each time. So I thank you everyone. Thank you to the speakers. We welcome any questions, so please feel free to email me. And with that, have a great weekend.